Okay, Berwin, I think we are being recorded now. So I just thought if we could sort of discuss how we understand supervision and what is supervision, because I think there are a lot of perceptions in the organisation, aren't there, about supervision that we come across in our work. And, it's quite interesting really to see how it's perceived, so when we talk about clinical supervision, what do we mean versus what other people or the perceptions that people have held to date in the different health professionals that we come across. So in your experience, how has supervision been perceived in the organization in recent years? Because I know you can go back many years, but in fairly sort of in the last, say, 5 years or so of your work experience, tell me about what you've noticed about how it's been perceived.
Well, obviously, it depends on what profession you're in and how supervision is part of the culture or not. And
Uh-huh.
concentrating on nursing, for example, it hasn't
Yes.
changed much over the years. There's still a lot of misperception, suspicion, um, you know, the question, why should we do this? It's an extra task, all these sort of I don't know, old chestnuts now come through, but it hasn't changed much. It's changing a bit. Uh, People, I mean, this has been going on since the 90s, so it's changed a bit over the years, but not that much. Still, the majority of nurses still need the awareness raising sessions about what it is, what it isn't, that sort of thing. And it's a good thing, but people don't perceive it necessarily as a good thing. It's still the idea of someone over your shoulder watching.
Yeah.
And a lot of that is to do with managerial supervision, I think, rather than the clinical supervision we would define it as.
Okay. So a sense of being scrutinized,
Mm,
that the perception is that it's being scrutinized in a fairly critical manner.
yeah.
That's one of the perceptions. I mean, there's two questions that occur to me as you're talking there. One is why, amongst, say, the nursing profession, hasn't the perception changed over the years? Why would you say that?
Well, I think the culture is pretty well defined in the sense that nursing is a doing rather than reflecting profession, and that persists. You've got to be, I think the minority of nurses, it usually bumps along at about 20% of nurses got the right idea about it. But I would guess, I'm talking not just mental health though, the nursing profession as a whole really is, it's really task orientated still, even though we give a nod to, well, we more reflective these days, it isn't, in my
So,
experience anyway.
so if we were thinking about supervision, the focus might be more about being than doing.
Yeah, indeed. Yeah.
Mm,
The idea of a reflective space to talk about your work, really. Um,
yeah.
and well, I talk to, we have a good team is the usual response. I talk to people on the ward is the usual response, and I would call that informal supervision. But really, to get the most out of it, you need to sit down in a formal manner and do it properly, as it were.
Yes. Okay. So there's something about having a structured conversational space
Yeah,
with somebody else that
yeah,
sort of brings out that reflective process. Would that be fair to say?
yeah. And the only other thing I'd add to that is it's someone you can trust. So it's sitting down with someone you can trust and talking about your work in a reflective manner. That would be a short answer to what is supervision.
Right. And I can imagine that some people who are, some people who are quite self-sufficient in their work, would say, well, I can do that on my own. You do get actually some people who are quite naturally reflective who say, well, I can do that.
Yeah.
What would you say to that?
Well, I think you need someone else to push you a bit in terms of things you hadn't thought of, or even picking up on the way you say things.
Yeah.
And to just notice things and then put it out there to the person you're with, and they usually say something like, "Oh, I hadn't thought of that," or "Oh, yeah, of course," that sort of thing. So it's a relationship of discovery sometimes at its best.
Right. Okay. Yes, and it makes me think there that the other person brings another perspective to the
Yeah.
situation. So inevitably that's going to add
Mm.
something to the perception of the situation by the
Yeah.
individual.
Yeah.
And just going back to something that you said before, because I'd like to hear about sort of your experience of supervision, really, as both a supervisee and a supervisor. So yeah, give me an example of when you feel that you've benefited from supervision.
Well, I benefited the most when I've chosen my own supervisor,
Hmm.
uh, because it hinges on mutual trust. Um, so it's got to be that when supervision's being chosen for me, it hasn't gone so well. But the best I get out of it is when I can trust somebody and talk openly about almost anything. Is how I'm feeling at this moment towards work. Who am I in my work? When it comes to that,
Yeah.
as well as the work itself, which in my case is usually client work usually, but at other times is tricky situations in work that I need to sort of bounce something off people and have a think about it. So it's an open agenda. So you bring, and the way I say that is I tend to bring things that are pressing for me rather
Hmm.
than like what I should be doing, like a managerial setup. So it's an open agenda. I
Yeah.
can anything I want. Usually
So
is guided towards work by the supervisor, uh, but it's usually how I feel about things in general and how that affects my work. So it can
yeah.
be open as possible for me. That's where I get the most out of it.
Yes. So it's a focus on the supervisee from what you're saying then, them first and foremost, even before the work. So if I was thinking of an example for myself, for example, I remember as a nurse working on a ward, and being quite frightened of one of the patients on the ward. And this
Mm.
patient was indeed, I think, experienced by most staff members as pretty frightening.
Yeah,
And when she'd sometimes walk down the corridor with a certain expression on her face and looked very threatening, the staff would run for cover into the staff room, and that included me.
hmm,
Um, Now, when I had some supervision with a very empathic supervisor, he enabled me to see that actually the person that I was afraid of was actually quite frightened herself.
yeah,
And
yeah,
although she was quite off-putting to everybody, so that made her feel even more isolated because everyone sort of ran away basically.
yeah.
If you actually did have the courage to go out and sit with her and talk with her, then that would help to ease her own anxiety and fear, and she would become less frightening, and as a result I was less frightened, and so on. But it
Yeah.
took a very empathic supervisor who really could sort of see into the feelings of this patient. So the supervisor at that stage was the uh, deputy ward manager on that ward, who enabled me to see that. But that's
That's
something that stands out for me where,
yeah.
do you
That's
see what
brilliant
I'm
when that
saying?
thing, yeah, that's brilliant when that sort of thing happens. It completely changes your perception then as a supervisee of what could be done, and
Yes.
it reduces the fear almost immediately. And
Yes.
that's happened with me a few times, something like that, that I just couldn't see past the behaviour, and
Yeah.
then having someone who's
Right.
well experienced or empathetic, as you say, can say, "Well,
Yeah.
have a look behind the behaviour. Sort of, why do you
Yeah.
think they're doing it like this?" Yeah, of
Yes.
course. course. And it's that sort of feeling. Of course. Why didn't I see that myself, sort of thing.
That's right.
That's
Because
yeah.
often we get stuck, don't we? I like the way you've put that, the behavior, that we get stuck in the behavior, as it were, in inverted commas, and our response to the behavior, and we're kind of stuck then,
Mm,
and it's really difficult to get past. And
yeah.
you think then it's impassable, and maybe get a bit cross and a bit pissed off with the patient. Oh, well, there's nothing I can do. So then it begins to breed a kind of an apathy,
Yeah.
and the curiosity goes down
That's
as
it.
regards the patient.
And that's another good word to use about supervision is the curiosity. I
Mm,
wonder why it's like it is. Let's have a think about it.
yes. Yes, is to sort of maintain, it plays a role in maintaining curiosity. I
Yeah.
wondered if you had any sort of thoughts or examples, Bear, of in your experience of being a supervisor and something to share about what you might have offered in supervision that's helped somebody else to go away with a different perception of a situation to when they came in the door with, or something that they
Yeah.
found
Well,
helpful.
something immediately happens, but it's well, I don't know how advanced or complex. Anyway, I'll just say it. The
Mm,
As a supervisor, I'm aware of my own reactions to the supervisee.
yes.
So generally, anyway, so I try and concentrate, give 100% attention to the supervisee and what's been happening.
So
But
you
this
really
one thing that comes into my head immediately is I lost my attention to the I started wandering off, and I record I started looking out the window type of thing. Didn't literally look out the window, but I caught myself doing it straight away. So
yes.
and wow, I said, look what's happening to me. I said, I never lose attention, but I'm losing my attention. So then queried, what's happening with you? What's happening with you and your supervisor and your client? And she
Yes.
stopped, and it was a moment of, yes, she said, I can see the client is ready to stop the counselling already. She's finished it was coming towards the end of the counselling anyway, but this was the
Right.
realization for her that yes, the client was doing the same thing.
So
You
the
know,
client had left the building. Elvis had
yeah,
left the building in a
yeah,
way.
yeah.
Yes.
And that was and just that little tiny incident,
Yeah.
because it was unusual, I brought it back.
Yes.
That's exactly what was happening in her room.
Yes.
And then she walked out with a different, okay, we need to bring this to a close because she's ready now to finish. And it was all
So
those sort of
as the supervisor, you had the courage there, because it does require a bit of courage, doesn't it, to actually share something of your experience of that loss of attention.
yeah. Well, it was unusual for me, so
Yes.
anything
Yes.
unusual, you
Sure.
can. So wow, why did I do that?
Yes. Yes. But at
and
the same time, sometimes perhaps some supervisors might fear sharing that back with their
right, yeah,
supervisee,
yeah. Again,
because they might think the supervisee then puts them in a place where, oh, I must be boring that you've lost
yeah,
attention to me,
yeah,
sort of thing.
yeah.
So there's
And I can
something
see that.
about the way you need to do that, isn't there?
Well, it depends on the trust then.
Yes.
The trust must be quite, is based on mutual trust. So
Yeah.
the supervisee I've been seeing for a number of years,
Yeah.
and she knows me really well, and usually I could, be forgiven for saying the truth, as it were. I
Yeah.
needn't pretend anything, so we were quite open with each other. But
Yes.
that built up, over time, well, fairly quickly with this particular person, because uh, she was she was doing studying body therapy, almost.
Yes.
Anyway, that's by the by. But so yes, you got to be able to trust the person you're with to be able to say things like that.
Yes. Okay. Now, just sort of thinking about, we've talked a little bit about individual kind of barriers to supervision, which is, the kind of opposite of trust, a kind of distrust of the process,
Yeah,
a perception of it as being very scrutinizing, that sort of thing. But when we're talking about clinical supervision, we like to make it clear that it's not actually delivered by a manager, that it should be delivered by another experienced and trained member of staff, who's totally outside of the management hierarchy, which we would see as being good practice in
Yeah.
supervision. And then there are some organisational barriers to supervision, aren't there? I mean, in the health board, what sort of organisational barriers to supervision have you encountered, in recent years?
Well, recent years, it's again, it doesn't change much. It's people on wards find it the most difficult to get supervision.
Yeah.
And that's historical, really, because things like supervision used to go on in the afternoon when there was a big overlap of staff, but that's eroded now. So there's really little overlap and very little time for things. But I say that, yeah. But I say that because in a historical context, it's important, because other professions get recognized time to do these things, whereas nursing, because it's done informally historically, it's never been confirmed as good practice or necessary practice. So that's a big barrier. The culture, basically, is the main barrier. Whereas other professions who are used to it, they build it in as a part of their practice, find it, there's no problem at all. They don't even think about it, other than they're having supervision. But with nursing, it's always been a big deal.
Yeah. Yeah. So, okay. So the nursing culture feels fundamentally ambivalent.
Yeah.
About supervision, about clinical supervision.
Yeah, and it's emphasised then with not building in time for it, or it becomes secondary. It's the first thing to go if people are under pressure. When it's the first thing they should have when they're under pressure, which is what it's kind of designed for, is people under pressure, how to work out the pressure, how to lessen the pressure.
Yes. So I think in that whole sort of life and death, if we were to think about why might that be the case, the idea of sometimes situations could be life and death, and what are you doing over there in the corner navel gazing?
Yeah, that's
you should be out here, come and restrain the patient before they kill themselves, or if you're in intensive care, come and resuscitate the patient, kind of idea. Rather than, we can do that, but then we don't get at the underlying reasons why people might be in the intensive care, or why they might be trying to kill themselves.
Yeah, indeed. So it's sort of firefighting rather than other professions build in. They cost it. It's about 5% of the cost of employing a nurse. That 5% should be around supervision, which is built in. So there are other people to cover for these emergencies. There shouldn't be, ideally, there shouldn't be that dilemma of do I stay out, do I go? Because it's to be built in, the staffing should be appropriate, but it never was and never is.
Yes. Okay, so there is kind of fundamental ambivalence out there. Just finally, if we were to say about the sort of hallmarks of good supervision, and we do have, like, let's say, a nurse out there who's going to look for a supervisor, what should they look for?
Well, so they need like a pre-supervision meeting of some kind. Because it's built on relationship building, they need to feel that they can work with the person they've selected or been selected for them. Ideally, you should select your own supervisor, but at the same time, someone who's not appropriate should equally be not taken up as a supervisor, or vice versa as a supervisee. So it's built on a relationship. So the initial meeting should be about, the question should be asked, can we work together? And then just to test that out, there should be, well, we work together, say, give it 4 or 5 times, and then we'll review it, see how we're getting on, and are we meeting a certain criteria that what you want from supervision? Is that being met? And if it's not, can we change it a bit, change the style a bit, whatever it may be? Or if it definitely doesn't work, then finish it.
Okay. Now I feel slightly different to you about total control over the choice of the supervisor, because I think sometimes people might select supervisors who might be a bit collusive and a bit
That's
cozy,
true. That is true. Yeah.
and I don't feel threatened by that person, so therefore I'm going to choose them. And
Yeah.
particularly the least experienced member of staff is probably going to do that, and I can really totally understand why they would want to do that as well. But that there may be, I think, a sort of an inverse kind of relationship about selecting supervisors.
Mm.
But that's a whole sort of different argument, isn't it? The other, so there's pros and cons
Yeah.
basically, aren't there? But
That's
in
what.
our organisation, we do have a central system where we
Yeah.
can actually do that, and it's not the manager allocating the supervisor, which we would be skeptical about,
Yeah.
but we're looking for a supervisor outside of the management hierarchy. And if there's a sort of a system in the organisation that can work with that, that would be another sort of possibility.
Yeah.
But the other thing that I was looking for there was, what about qualifications of the supervisor and readiness of the supervisor to supervise? What would you
Oh,
say
right.
about that?
Yeah. Well, training is important. Yeah.
Yeah,
Because it's relationship building, you need sort of a relationship training sort of background as well as the supervision skills in particular. So it's both things really. The
yeah,
relationship is the important thing, and then closely followed by the skills of the supervisor knowing what they're doing, sort of thing. Which is about structure, about challenge, about reflection, all that sort of the background skills that they need to bring to it.
yeah,
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 so training is important.
yes,
Uh,
okay.
and again, awareness training for the supervisee, I think, is
Hmm.
important as well. So
Okay,
they're going into supervision with their eyes wide open, as far as
okay.
possible.
And then finally, a final thought on individual versus group supervision. Quick thoughts on that?
Oh, one-to-one is the focus is on you. You can hide in a group, or alternatively, the group could be important by bringing different points of view in, things that in the one-to-one you wouldn't think of. So
Yeah,
that so they both got their pros and cons.
great. Okay. And I think what I'd add to that in relation to the group is, yes, one to one you can get a sort of narrower perspective as time goes on, so there's more opportunity, I think, for potential collusion.
Mm.
Whereas in a group, because of the diversity that you can potentially have in a group, and the perspective, I think that can be extremely supportive, although sometimes people might ironically feel a bit more exposed.
Yeah,
But that actually the networking and supportive capacity of the group is usually what comes into ascendancy there.
mm. Personally, as a supervisee, I prefer one-to-one
Do
because
you?
stuff
Yeah,
I'm doing is
yeah,
needs some focus on usually, and I can
yes,
skirt around in a group without not.
yeah.
Anyway, yeah, just
Yeah, handing it to somebody else who's got more important things to talk about than
yeah,
you, sort of
that's it.
thing.
Yeah,
Yes, yes. No, I'm a groupie.
right.
I'm a
Okay.
groupie. Okay. Thank you very much, Barwin. We'll stop there for the time being.
Okay.
Thank you.
Okay. Thank you. Cheers now.
All right, stop recording.